let me discuss another important antiplatelet drug, that is silastazole. So this particular silastazole, it is a phosphodiesterase 3 inhibitor, right? It is right, it is a phosphodiesterase 3 inhibitor. Now, once this silastazole inhibits the phosphodiesterase 3 enzyme, this results in elevated cyclic AMP. Right, this results in elevated cyclic AMP. Now, this elevated cyclic AMP, what it does? This elevated cyclic AMP, it reduces the platelet aggregation. Right, it reduces the platelet aggregation. And not only it reduces the platelet aggregation, it also possesses the peripheral vasodilatory action. Right, this cyclic AMP, it also possesses peripheral it also possesses the peripheral vasodilatory action. Now, this silastazole, where is it being used? It is used in the treatment of the peripheral vascular disease. That is, it can be used for the treatment of the intermittent claudication. Right, it is used in the treatment of the intermittent claudication. And what is the main problem with all these antiplatelet drugs? The main problem with all these antiplatelet drugs will be bleeding. Right, main problem with all these antiplatelet drugs will be bleeding. Now, if you take this antiplatelet drugs, where they are being used. So until now, I have discussed all these antiplatelets. We have one more group of antiplatelet drugs, that is newer antiplatelets, which I will be discussing now. But what are the uses of these antiplatelet drugs? Antiplatelet drugs, they are used for the prophylaxis of MI, and they are also used in the treatment of MI. Okay, so they are used in prophylaxis and treatment of, right, they are used in the prophylaxis and treatment of the acute MI. And preferably, which antiplatelet drug is used in the treatment of MI? That is mainly the aspirin. And another clinical scenario where we use this antiplatelet drugs is the cerebrovascular accident. In cerebrovascular accident, we use the single antiplatelet, preferably aspirin. And in those individuals who are not able to tolerate this aspirin, we give this Clopidogrel. And another important scenario where we use this antiplatelet drugs is where you have the presence of the artificial valves, right, where you have the presence of the artificial heart valves. And these artificial heart valves, right, these artificial heart valves, they are nothing but your prosthetic valves. So in these scenarios, we use this antiplatelet drugs. Now, after having discussed about this silastazole, please remember, it is mainly used in the treatment of the peripheral vascular disease, that is intermittent claudication. Then what do you understand by this word intermittent claudication? Intermittent claudication is that where the individual will have pain in the legs upon walking, right? So these individuals, they have pain upon walking and they take rest. Once they take rest, the pain is reduced. Right? Once they take rest, the pain is reduced. And upon walking, right? Upon walking, again there will be onset of pain, right? Again there will be onset of pain. So this is what is the clinical manifestation in the intermittent claudication, right, where we use this silastazole. And this particular silastazole, which is being used in the treatment of the peripheral vascular disease, is being used twice daily, once in the morning and as well as once in the evening. And how will you diagnose this peripheral vascular disease? Right? This peripheral vascular disease can be diagnosed by doing ABI. So ABI stands for ankle brachial index. Right? If there is any abnormality within this value of ankle brachial index, then we can diagnose that the individual is having peripheral vascular disease leading to intermittent claudication, for which we need to give this silastazole. Now let me discuss the new antiplatelet drugs. These new antiplatelet drugs, they act by reversibly inhibiting P2Y12 receptors. And what are those drugs? Let me discuss. So let me discuss this new antiplatelet drugs. So these new antiplatelet drugs, one of the very important group is reversible P2Y12 receptor antagonists. Right? They are reversible P2Y12 receptor antagonists. Now, what are the examples of this reversible P2Y12 receptor antagonist? That includes ticagrelor and as well as the cangrelor. Right, ticagrelor and as well as the cangrelor. These are the direct acting reversible P2Y12 receptor antagonist. Right, these are direct acting reversible P2Y12 receptor antagonist. Now out of this, if you take this ticagrelor, it is given orally. Right, it is given orally. It is orally effective. Then when you compare this ticagrelor with the clopidogrel, clopidogrel is what? Clopidogrel, it is irreversible P2Y12 receptor antagonist. So this ticagrelor as compared to clopidogrel, it produces greater and more predictable antiplatelet action. So this ticagrelor, it has greater and more, right, greater and more predictable antiplatelet action. Right, it is having greater and more predictable antiplatelet action. Now, this ticagrelor, it also has more rapid onset and offset of action. Right, compared to clopidogrel, it has rapid onset of action and it also has rapid offset of action. Right, it has rapid onset and offset of action as compared to that of the clopidogrel. And this ticagrelor, it is the first new antiplatelet drug to demonstrate a great reduction in the cardiovascular death compared to that of the clopidogrel. Okay, so this ticagrelor, it is found to reduce, right, it is found to reduce the cardiovascular death in patients with MI or coronary artery disease then compared to that of clopidogrel. Okay, and this ticagrelor is given in acute coronary syndrome. Now, what are the clinical entities which are included in acute coronary syndrome? The clinical entities in the acute coronary syndromes, that includes number 1, unstable angina, number 2, non-ST elevation MI, and number 3, ST elevation MI. Okay, so these three are the clinical entities which are included in acute coronary syndrome, and this ticagrelor, it is found to demonstrate a greater reduction in cardiovascular death than clopidogrel in patients with the acute coronary syndrome. And this ticagrelor, it is recently approved by the FDA. Right, it is recently approved by the FDA. And another important reversible P2Y12 receptor antagonist, it is the cangrelor. If you take cangrelor, the route of administration is, right, the route of administration is intravenous route of administration. So cangrelor is intravenous reversible P2Y12 receptor antagonist, right, and it is also approved by FDA, or it is like in the later stages of development. So this is about the new antiplatelet drugs, that is your reversible P2Y12 receptor antagonist, that is ticagrelor and as well as cangrelor. Now, apart from this, we also have another set of new antiplatelet drugs, that is PAR receptor antagonist. Now, let me discuss the another new antiplatelet drugs, that is PAR antagonists. So, the next important group of the newer antiplatelet drugs are PAR1 antagonist. Now, what does this PAR stands for? PAR stands for protease activated receptor 1, right? PAR stands for protease activated receptor 1. Now, where are these receptors present? These receptors, they are present on the platelets, right? These receptors, they are present on the platelets. Okay, so this is your PAR1 receptor. Now, onto this PAR1 receptors, right, onto this PAR1 receptors, this particular thrombin will come and bind to this PAR1 receptors, right? This particular thrombin will come and bind to this PAR1 receptors which are present on the platelets. Now, what are the examples of this PAR1 receptors? The examples include, number 1, Vorapaxar, and then Atopaxar. So these are the examples of the PAR1 receptor antagonist. Now, what these drugs will do? These drugs, you take this Vorapaxar, it is given through oral, right? The route of administration is oral route of administration. So it is an orally active inhibitor of the thrombin receptor on the platelet. Now, what is the thrombin receptor? The thrombin receptor is PAR1. So this Vorapaxar will come and inhibit this particular receptor. Now, once this receptor is inhibited, the thrombin cannot bind to the platelets, right? Thrombin cannot bind to the platelets, and thereby this Vorapaxar, it will inhibit the platelet aggregation. Right, thereby it inhibits the platelet aggregation. Now, where is it being used? It has recently been approved as antiplatelet drug in patients with history of MI or peripheral arterial disease, right? So, if you take the uses of these drugs, right, it is used in the treatment of MI and as well as used in the treatment of the peripheral arterial disease, right, in the treatment of MI or peripheral arterial disease. So, this is about your Vorapaxar. So, Vorapaxar, it is an orally active inhibitor of thrombin receptor on platelet called as the protease activated receptor 1. And this Vorapaxar and Atopaxar, it has been recently been approved as an antiplatelet drug in patients with history of MI or peripheral arterial disease. So, this completes the discussion of the antiplatelet drugs. So, antiplatelet drugs, we have the COX inhibitors, that is your aspirin. Then we have P2Y12 receptor antagonist. This P2Y12 receptor antagonist, again we have reversible and as well as the irreversible. The irreversible are the Clopidogrel, Prasugrel and as well as the Ticlopidine. Whereas if you take the irreversible P2Y12 inhibitors, we have the cangrelor and as well as ticagrelor. And another important antiplatelet drug is phosphodiesterase inhibitor, that is dipyridamole. And next important group is glycoprotein IIb/IIIa inhibitors, that is abciximab, tirofiban and eptifibatide. And then we have PAR antagonists, that is vorapaxar and as well as the atopaxar. So this finishes the discussion of the antiplatelet drugs which are used in the treatment of the acute MI, cerebrovascular accidents and as well as the peripheral arterial diseases.